Hi, Dr. Tam here. So today I want to go over with you why it's important for you and your child to get adjusted. We work with pregnant moms, newborns, little ones, 2-year-olds, 5-year-olds in here. When you come here during the day, you're going to see little kids running around. And the reason why they get adjusted is because a lot of times the parents are educated on why chiropractic is so important for the child's development. One of the kids I take care of, he wasn't developing correctly. And when I say he wasn't developing correctly, he just wasn't reaching his milestones. From rolling to standing, sitting, to crawling, it just wasn't right. So mom, as he was learning how to crawl, well, he always crawled on one side more than the other. And eventually he ends up doing circles because his hip, one hip will move this far, but the other hip will only move half as far. And eventually his body started to do this. And over time, mom noticed that and noticed that he was only going one way and didn't like to go the other way, or starting to not look the other way as well. One mom started talking to another mom who was already one of our patients. We brought the little one in, started getting him adjusted, and over the next, it only took 3 weeks for the little one to start crawling correctly. And we looked at his crawl pattern and he was moving the right way. On top of that, the huge thing that mom noticed was he started saying things a lot more. He slept way better. And one thing that I didn't know was that he was having irregular bowels. Mom never mentioned it. And he started using the bathroom and pooping a lot more regularly ever since he got adjusted. Now, why do kids get adjusted and why do they get hurt? Well, you think about it. When you're pregnant, okay, moms or dads, when your little one is pregnant in the womb, what happens is they're in a very tight space. And during the delivery, if the medical doctors, nurses, if they're pulling natural birth, right, they're pulling on your child, naturally some kids get their heads pulled on 15, 30, some studies even say 60 pounds. And when that happens, it puts a lot of tension, a lot of traction onto their neck. Now, you may not notice it right away, but sometimes the kids may not be able to breathe correctly. And you look at their APGAR score, okay? One thing that I urge every new parent to look at is their APGAR score. And why that's so important is because the APGAR score measures a multiple of different things. But a 10 is normal. Anything less than a 10, 8, 7, 6, 5, 4, 3, 2, 1, okay? Maybe a 9, it's okay. But anything less than that means that something wasn't right to begin with. Maybe the little one was still very blue at the beginning. Maybe the breathing wasn't right. Something wasn't right. And when that happens, well, there's a problem. But most of the time, people and the professionals will tell you, oh yeah, you know what, a 7, 6, that's normal. Well, that's not normal. It may be common, but that's not normal. It's like headaches, right? You start asking people around you and they get headaches and they say, oh, you start thinking that, wow, headaches are normal. No, headaches are not normal. They're common, not normal. Okay, but these children, you don't really start seeing a problem until they start hitting their milestones. Okay, are they lifting up their head? Okay, at a certain time, are they rolling? Can they not lift their head? Or maybe when they're breastfeeding, they only like to breastfeed on one side, and then you take them to the breastfeeding specialist or the doctor, and they tell them that, oh yeah, you know what, they only like to feed on one side, not the other. Well, that's insane to think that, because it's not supposed to be that way. Why is it that your child only turns their head one way and not the other? See, but you don't realize these things until they start hitting some of these milestones. And when they start to hit some of these milestones, as you start to notice it as a mom, moms have an intuition. I can't explain it. It's just moms just know. They feel, you guys moms, you are able to feel that something is not quite right with your child. If they're not moving just the right way, or if maybe they only roll to one side, and you just notice it. And usually, if not the rolling, if not the sitting, definitely by crawling, mom, you're gonna know. You're gonna know because one of the first signs is your child doesn't really pick up its head very well, or it's not going to crawl correctly. You watch a child crawl, and here's what, as moms, I want you to look at. If you start to notice one knee is going forward a lot more than the other knee, or they like to only move one side and not really so much the other side, the hips or the shoulder, make sure you bring them to a competent chiropractor who works with children on a regular basis. If you're in the Solano County area, we're located in Vacaville. We have kids coming from Davis, Dixon, Vacaville, Winters, Fairfield, Cordelia, Vallejo. If you are a mom in this area and you like to get your child checked, which I highly recommend it, my daughter's been adjusted ever since 6 hours old, and what a blessing that is for me to be a chiropractor and her to be adjusted since that age. Make sure you contact us. Give us a call. If you are outside the area, okay, let us know. Give us a call anyways, so I'm able to help you, direct you to another competent chiropractor who sees children in your area. I have kids myself. I'm one child myself, and she's 6 years old. And watching her grow has been a joy. Watching some of the other kids grow up, from the pregnant mommies that I'm taking care of to the time that they're babies and now they're toddlers running around. They're like 6, 7 years old, to the ones that when they first started getting adjusted, they're just coming in their strollers, to now they're in first and second grade and third grade. It's just been a blessing. It's been amazing, and I want the best for our children, and I want the best for your child as well. So hopefully you learned a lot. Until next time, this is Dr. Tam from Vacaville. Have a great day.